And I'm a resident of Monroe County, New York, and I'm also the mother of an 11-year-old son with an autism spectrum disorder and ADHD. I would like to extend a thank you to my colleagues of New York State Partners in Policy Making and their guests for giving me the opportunity to provide a testimony today. I would like to address the lack of providers within Monroe County that accept Medicaid. Imagine sitting at your desk at work and your phone rings. You look at the caller ID and you immediately feel defeat because you recognize the number is coming from your child's school and you can already guess why they are calling. Unfortunately for me, this happens far too often. I have received multiple calls from the principal where I can hear my son violently screaming in the background, and it is the most helpless feeling. There have also been multiple times where I've had to put my job in jeopardy and literally drop everything to drive 25 minutes to school and pick my son up because of his violent outbursts. One outburst was so violent that he needed to be restrained, which is something that no parent should ever have to witness. When my son was diagnosed with an ASD, it was estimated that 1 in 110 children had one. From there, it changed to 1 in 80. Currently, it is 1 in 68, although a recent study indicates it is closer to 1 in 45. It is well known that many people with an ASD also suffer from some sort of mental health issue. Why then does New York State not reimburse private practicing therapists for Medicaid? With my son, we do not see his violent, angry behavioral outbursts at home, only at school. He's high functioning, but he is unable to verbalize why the outbursts happen and why he has so much anger. Both the school and his doctor have recommended that he see an outside counselor, and I agree that he definitely could benefit from one, particularly one that has experience with children his age and with children on the spectrum. In my household, like many others, money is tight. My husband and I both work full-time, and I also work part-time. Our health insurance is a high deductible plan, which means that I have to pay out of pocket for any sessions with a therapist because we've not yet met our deductible. I've been told that Medicaid is supposed to help us, but to date I fail to see how. Anne Marie T. Sullivan, MD, Commissioner of the New York State Office of Mental Health, states, "The annual loss of productivity in the United States due to depression alone is over $40 billion. Care that is early, collaborative, and expert assists in recovery. Therefore, in the Empire State, we should expect access in every community to clinically and culturally competent mental health care that supports recovery. I urge you to please consider allowing more providers to accept Medicaid, as the number of people enrolled in Medicaid is increasing every year. As of November 2015, Monroe County has 142,979 people enrolled in Medicaid managed care. This is up from December 2014, where 133,079 people were enrolled, and up even more from December 2013, where 103,631 people were enrolled. With private practicing therapists not permitted to accept Medicaid, this leads to a lack of quality care, overloaded clinical settings, and long waiting lists for care. This raises the question, how many people opt to not follow through and receive services because of the hassle and the wait to receive them? This does not only affect mental health. My son has been told by a dentist that he needs braces, which we will definitely struggle to afford. Currently, there is only one orthodontist practice in all of Monroe County that accepts Medicaid, so we are on a 1-year waiting list just for a consultation. With 142,979 people enrolled in the Medicaid managed care program, how can one office possibly serve all of those in need? I'm sure that you would agree that children should not be denied services of any kind simply because the government does not feel the need to reimburse providers for their services. Thank you for your time, and please remember that having a child with a disability is difficult enough, so I urge you to please consider making changes to the Medicaid program to make things slightly less stressful for families in need. Thank you.